So you can reassure him, like, sometimes the symptoms of chest infections because of COPD can overlap with the lung cancer symptoms. But definitely, I don't know at this point that what exactly happened. So why don't you come to the hospital and we can have a meeting with our seniors, and we can involve the GP as well. How does that sound to you?
Yes.
Right?
Okay.
We can talk about the entire situation. So it's just that, it's simple as that. We don't know, and we will talk to the GP, and then we can do this. But you can, definitely mention like COPD and carcinoma symptoms can overlap, and unnecessary investigations can lead to a lot of things, like you mentioned about the radiation exposure. You can also mention that point. And there is one more point as well, like, not always lung cancer is diagnosed by the chest X-ray. It can be missed. So it is not a treatment of diagnostic modality, our choice investigation for the lung cancer. But still, I can see, I can feel where you are coming from, and we are definitely going to help you out in this matter. And if he's still not agreeing, then what we can do? He's still saying like, look, no, I want to complain, it's your right to complain, definitely. So he wants to complain about the GP. So Dr. Javed, who will be responsible for taking the complaints?
I think in the GP setting, there should be a person there in charge of the GP setting.
Not PALS, because PALS is in the NHS hospitals, and most of the times GPs are not, they are entitled to provide the NHS services, but they are not directly employed by the NHS. So you can mention about that. You can either complain to the GP surgery, or directly you can go there and talk to the regulatory body there, or you can also, there is a body which is responsible for paying the NHS services and all. We call it as Commissioner of Services, right? So definitely it's your right to complain. If you think that the care of your mother is compromised, you can always make a complaint about that. You can go to the GP surgery or Commissioner of Services.
Okay.
Right? And if you still have time, then you can talk about her mother, like, please bring her here. We will be definitely taking care of her. And you can talk about dementia. Like, do you have any help? Do you need a dementia care plan? And everything, right? Depending on your time.
Right. Yeah.
Right?
Yeah, that's very good.
So I hope, you have a clear understanding of this station.
Yes.
Anybody has any concern? Thank you, Dr. Javed.
Thank you, Dr. Aini. Thank you so much for your time. Appreciate it.
There is a question, excuse me, that there is no, like in the hospital setting, there are meetings, root cause analysis. Such things do not exist in GP services. I just want to confirm.
I'm not quite sure about that, but I think they don't exist, because the root cause analysis meeting, I don't think it is in GP
hospitals. Yes.
Dr. Saira, they can do this kind of meeting in GP as well. We can.
Okay,
I think
they might be calling it something else. Oh, okay.
Yeah, you like you can say monthly meeting.
Right.
Okay.
Monthly or weekly meeting.
There is, in GP there is practice manager. Dr. Farooq told once.
Yeah, in GP practice manager and monthly meetings. You can talk like that.
Yes, that's better. The better wording. Thank you.
Okay, any other question?
Somebody was asking to explain how to be in the middle grounds.
Yeah, so I explained it already, that you have to reassure the patient and tell the patient like this can be sometimes, overlapping and all of these things, but definitely we don't know. We are going to inquire about this matter more. We will talk to the GP, right? And we can arrange a meeting. You can come, I will involve my senior, and we will sort out what happened. So this is the middle ground. We are not blaming the GP. We are not defending him.
Any and no incident form here, right? Just to confirm.
Yeah, because we don't know if the incident has happened or not. So how we can do this? If there is it is a negligence or delay in care by the GP, then there is definitely going to be an incident form. But not right now, because we don't know.
Okay, I think that's it about the questions. Thank you, Annie. Thank you, Dr. Javed.
Welcome.
Let's do
Thank
the
you, Dr.
last
Javed.
session of today with Sarah. Sarah, are you there?
Yeah, I'm here.
All right, so let's do the session with you.
Hello.
Hi, doctor.
Yeah, you're talking to Dr. Kasibwa, one of the doctors here. And could you please confirm your name and age?
Yeah, doctor, my name is Angela and I'm 62.
Okay, Angela, nice to meet you. So I can see you're coming back for your scan results.
Yeah.
Okay, and I have the scan results here with you. Would you mind telling me why you came for the scan results in the first place?
Because doctor, I broke my wrist 3 months back, and they thought it might be because of some soft bone, so they did a bone scan for me.
Okay, I'm really sorry to hear about that, Angela. And how are you doing now?
Yeah, I'm better.
Okay, and when did where did you have the fracture?
On my right wrist, doctor.
Okay, and are you able to use your right wrist well?
Yeah, now I am using it.
Okay, that's really good to know. No pain at all?
No.
Okay. And I'll just like to ask you about your general health. Was it the first time you're getting this the fracture in your right wrist?
Yes.
Okay, and any medical conditions at all?
No.
Any previous surgeries?
No.
Okay, and any medications you're taking?
No.
Any family history of any medical condition or fractures?
No.
Okay, and Angela, like, what do you do for a living?
Doctor, I am retired now, but I was a school teacher.
Okay, and are you enjoying your retirement now, Angela?
Sorry?
Are you enjoying your retirement? Like, are you enjoying your retirement?
Yeah.
Okay,
I'm
and
living with
who do
my
you feel?
husband and my kids, and I'm enjoying this time.
Okay, I'm really glad to know that. And just about just your lifestyle. Like, could you please tell me about your diet?
My diet is okay. Sometime we eat out, sometime I cook at home.
Okay, and what do you usually eat, like dairy products or vegetables?
Yeah, I'm vegetarian.
Okay. And is there any reason why you can't eat dairy products?
Because I'm vegetarian, so I don't prefer dairy products.
Okay, no worries. And are you on any kind of supplements, like vitamin supplements?
No.
Okay, and do you go to the sun for any reason, like at least to like the sun?
Yeah. I go for sunbathing and things like that.
Okay, I'm really glad to know that. And do you do any form of exercise?
No, doctor.
Okay, and do you smoke at all?
I used to smoke, but now I'm not smoking.
Okay, and any alcohol at all?
Social drinker.
Okay, okay, okay. And I'll just like to know, like, when did you last go into your periods? Because
It was 4 years ago.
okay, and are you on any kind of hormonal treatment?
No.
Okay, okay. So thank you so much for answering all that. I would like to examine you. I would like to first take your temperature, heart rate, blood pressure, and I'll do a general physical examination to just make sure your wrist is okay.
Okay.
Is that okay? Okay. So has anyone updated you about the scan results?
Sure.
Okay. So do you have any idea about the scan results?
I
Hello?
think, doctor, like I'm worried about soft bone. So am I having soft bone as well?
Okay, that's a really, really valid concern. And what do you mean by soft bone?
The bone condition, my friend was diagnosed with that few days back. So I was worried about that.
Oh, I'm really sorry to hear about that. And how is your friend doing now?
She's taking some medication and her GP told him about few things that she need to do right now. So she's better.
Okay, okay. I'm really glad to hear about that. Okay, so now coming to the scan results. Um, um, so um, so the scan results show that from because you told me you're concerned about weak bones. So the bones, it came back and showed that your bones are weak or thin.
Oh, wow. Oh, that's why I had a fracture.
Yeah, and that condition you call it osteoporosis.
Oh, I see. So, doctor, why am I having this?
That's a really valid concern. So this kind of condition, it has both modifiable risk factors and non-modifiable risk factors. For the non-modifiable risk factors, sometimes because of the age, you can be having this. But fortunately, we have some factors that you can modify, like the diet. You told me you don't eat any dairy foods, exercise, and we shall talk about that in depth of how we can how they can help with the bone strengthening.
Okay.
And I'll also give you some written information about this. So let me just give you a layout of what we're going to talk about, and then we shall discuss in depth, right?
Okay, doctor.
Okay, so my senior is also going to come and review you. And we may give you some vitamin supplements. And we may need to also get in touch with a dietitian to get a dietary plan for you, and maybe a physiotherapist for some exercises of bone strengthening. And we shall be giving you follow-up appointments to see how you're doing. Are you with me?
Yeah, doctor.
Okay, but at any time you notice that the bones are becoming weak, or you're getting any fever, or there is any pain around any bone, please don't hesitate to contact us immediately.
Okay, doctor.
Okay, and about your diet and exercise, is there anything like worrying you that you want us to start with?
Doctor, I want to know, you talked about some medication. So what medication you were talking about?
Okay, that's a really, really valid concern, Angela. So for this kind of condition, we usually first prefer, let's say, the lifestyle, and then only just some supplements like vitamin D, calcium supplements that help with bone strengthening. And then if that doesn't work, then you may need to refer you to the bone specialist. Maybe you can start you on some medications for the bone strengthening.
Okay. Okay, I see. So can I get a fracture
Okay,
again?
and that's a really valid concern, But if you follow what you're going to talk about, like about your diet, about your exercise, physiotherapist, dietitian, most times you can prevent this from happening again.
Okay, doctor.
Okay. So you can talk about your diet. So concerning your diet, you said you don't like, you're vegetarian and you don't eat dairy products. But in the supermarket, we have what you call vitamin D and calcium fortified foods, and they don't contain any dairy. Maybe you can try that.
Oh, okay. Yeah, I have seen that kind of food, but yeah, I can try that.
Yeah, because calcium is the one which helps with bone strengthening, and vitamin D helps with absorption of calcium. So you can try that. It really helps.
To the next station.
Okay. Okay. Good attempt, Sarah. It was like you were able to cover my concerns as well. Your data gathering was fine. Just you skipped few things. It would have been great if you could have asked, like in the past, when you were talking about past, like what happened. I told you about my risk fracture, so you could have asked me what was advised, what they advised you about that. Okay.
Okay.
So then, because when you are asking about painkiller and these kind of things, when you are assessing her currently, at that time you can ask. At that time you can ask her, did you follow the advice? Like sometimes they have given her painkiller. Sometimes they might have given her some kind of supplements as well at discharge. Okay. So that discharge question was important. What advice did they give you at the time of discharge? In current symptoms, you asked me about pain, right? You asked me about swelling, right? You can ask another question as well. Any other problem that is concerning you at the moment, like you are looking for any new symptom.
Okay, yeah.
Okay. And after that, I told you that the problem was with my diet. The problem was that I was not exercising. I was vegetarian. And when I'm telling you that I have left smoking, you need to say something here.
Yeah. Yeah, true.
Okay. And also another risk factor was the menopause. It was 4 years since menopause. So, after menopause, because estrogen is not there, so bones get weak. So it might be a risk factor when you were covering the risk factor.
Yeah.
Okay.
Yeah.
Okay. So after that, you will be covering your management. You need to tell her the test report. After then you covered the risk factor because I asked you, and then you gave the layout. That was really good because by giving the layout, you covered almost everything in a shorter period of time. One thing that was missing here was about bisphosphonates. She is having osteoporosis, so we might need to start. Say might. Okay, when you are talking about medication, calcium, vitamin D, and we might need to start you on another kind of medication called bisphosphonate to strengthen your bones.
Okay.
Cover that
Thank you.
as well. Otherwise, you covered all the things in your management. That was really good. You did safety netting. You can talk about follow-up as well.
Yeah.
Okay. If you are talking about bisphosphonates, then what will you telling to the patient? Like if you are talking about that.
Pardon, Dr. Chris.
Sorry?
Pardon on what you said?
You are talking about bisphosphonates. So how you are going to tell me about that?
Okay. So we can talk about the lifestyle first, but if this doesn't help, we may need to refer you with my senior specialist who may give you some medication. And this medication help with bone strengthening. It's called bisphosphonates. And like any other medication, it has its own side effects that we shall discuss.
Pause first, then talk about side effect.
Okay,
stop. When you have told me about the medication, stop, and then let me ask something. Don't cover the side effects first.
Okay. Yeah.
maybe I'm not concerned about side effect. The next question I want to ask is how I am going to take it.
Mm. Good
So,
point. Yeah, yeah.
so what will you say?
So what's your question? Like side effects, right?
No, my question is how I am going to take it.
Okay, okay. So that's a really valid concern, Angela. So this medication, like any other medication, it has some of the side effects. And but before we go to that, it's taken through mouth. And when you take this medication, please make sure at least you be straight, either sit straight or stand for 30 minutes to help with some of the like heartburn. And yeah.
You have to take it on
Okay.
empty stomach.
So why you said about
And
side effect as your first line, Sarah? Hello?
yeah.
Sorry. Side
Yes.
effect was not needed, right? I am asking you about how to
Yeah.
take it, then cover that chunk first. No talking about side effect. It's not. I'm not talking about it.
Yeah, I realized later that you
You want to
about the
show that
medication.
you know about side effect, but I'm not interested. I want to know how
Yeah.
I'm going to take it.
Yeah, yeah.
One tablet, I think, every Sunday and
Yeah, weekly. One tablet weekly, early morning, without eating and drinking anything, and with a full glass of water. Sit upright for 30 minutes at least.
Okay.
This will be the advice you will be giving her about the medication, how she's going to take it. And I think apart from that, you covered all the things. I did not give you history of ovarian ovaries and uterus removal. But if that is there, then you need to talk about that as well. Thank you so much, Sarah. Now I am going to look. Any questions, Sarah?
No, not really. Thank you so much. At least you've addressed my concern. So in this patient, since the patient had a fracture, should we like talk about the bisphosphonates there and then, or we can say we shall refer you to the specialist for bones who will prescribe you some medication, and maybe pause and ask about and let the patient ask questions.
You can say we might need to talk about some referrals, like referral to dietitian, referral to gym instructor for weight bearing exercise, and some bone specialist as well. You can say that. And you have told about the referral, and after that, when you are giving the medication plan, you are telling the summary. What is the summary of medication plan for her? We will be starting from the lifestyle, and there are some medical options as well, like we will be talking about some supplements. We might need to start you on a medication called bisphosphonate for strengthening of the bones.
Okay. And the GP can prescribe that, right?
Yeah.
Okay.
But you are a junior doctor, so I think you talked about your senior before prescribing that, and that's fine.
Okay. Thank you.
You are welcome. Postmenopausal symptoms, if like it's up to her. Like I am here for osteoporosis, right? I am here for the blood test report. I am not here to talk about menopause symptom or not. But if you are asking about the concern, you are asking the concern from your patient, and she is bringing up any kind of topic like that, then you can talk about that. Otherwise, it's not needed.
Dr. Kurat, it might be important because if she's on HRT by any chance, then that is protective against osteoporosis. So that might be a point, isn't it?
I think she asked me about that.
She did. Okay.
When she was covering that my last menstrual period, at that time she asked me.
But the patient was not on HRT, is it?
Yeah,
no.
She was not on HRT. So HRT, HRT is not a treatment of osteoporosis. HRT is for other symptoms as well. So we are basically talking about osteoporosis here.
Mm-hmm. Yes, basically for autonomic symptoms and other things.
Yeah. And also the bisphosphonate, somebody's asking how to take it. We will be taking it on empty stomach in the early morning. Yeah, if her main concern is about the fall, then you can talk about that as well. But actually, we need to be sure. We need to make sure that we are not wasting too much time in talking about the fall. The main chunk of the station is this talking about blood test reports. So talk about the blood test report, cover the management, and after that, if you are not sure what to talk about, like if you are having, like Dr. Sarah was having time, at that time you can ask about her concern. And if she is bringing up the topic like, can I fall again, and this kind of thing, then you can share some advices regarding that as well. It's always good to ask concern in the management again, even if you have asked about that earlier on. So by the end of your management, you can ask again about this, any specific concern or expectation from today's consultation.
Dr. Kurat, to whom we usually refer for exercise training? Is it physiotherapist or gym instructor?
Gym instructor. Gym instructor.
For any
Okay?
sort of.
If she is mentioning about any problem with her wrist, like if the wrist is not fully mobile, there is still pain, then you can talk about physiotherapy as well. Otherwise, gym instructor will be fine. And when you are talking about investigations, at that time, talk about BMI as well.
Yes.
Her vitals and BMI.
Maybe physiotherapist is for admitted patients, right?
Sorry, I missed your question.
Yeah, maybe physiotherapist is for admitted patient.
Yeah.
For admitted patient, and gym instructor for like outpatient. If they need any advice regarding exercise.
Physiotherapy can be for outpatient as well. Okay, like if patient is coming with carpal tunnel syndrome, we are not admitting the patient, but still we can talk about physiotherapy. It depends on case to case. So physiotherapy is basically for the movement problem. If something is wrong with the muscles, there is a fracture, about that. But fracture happened 3 months ago. Right now, patient is symptom free. Now patient is coming with osteoporosis. We are talking about gym instructor. Why? Because in osteoporosis, we want her to do some weight bearing exercises. Weight bearing exercises will strengthen the bones. In the osteoporosis, it is important. That's why.
Yes, thank you.
Dr. Kurat, one question, this gym thing, is it the expense covered by the NHS?
Yes, if it is due to, like if in this osteoporosis, I think it will be covered by NHS. Sometime it will not be covered by NHS. So, but don't go in detail of that. Don't bring that topic up.
Thank you.
And if you are not sure, you can always say, I will check with my senior, or I will check with somebody and I will let you know about that.
Yeah, covering your back all the time.
And
thank you. It was a very good session.
You are welcome. Sometimes she will tell you about swimming. So swimming is an exercise, but still swimming is not protective against osteoporosis. For osteoporosis, we want her to be on a weight bearing exercise. It doesn't mean that doing dumbbell and these kind of things. Weight bearing exercise can be jogging, running, walking, these kind of things as well. But swimming is actually good cardiovascular exercise, but it's not weight bearing. So it is not protective for osteoporosis, right? So we can advise her about these kind of things: running, jogging, walking, and further guidance they can get from gym instructor. Okay, I think that's the end of session, and I guess I have answered the question as well. Yeah, somebody asked about that temper tantrum, how you are going to disclose that. So you can say, from the little chat we had, it seems like your child is having some kind of behavior problem, and it seems to me that it is very common at his age, and it seems to me that it's not because of autism. Because if you have talked about the concern earlier on, then with your disclosure part, you can talk about concern. Okay, so you can say that I can, as you mentioned that